and welcome back to the MVS podcast. I'm Fee Farmer, I'm a vet, and I'm your host for today. As with every episode of the MVS podcast, we take a deep dive into topics that vets encounter on a weekly basis and bring the latest thinking and advice to the discussion. Today we're talking about post-op wound recovery and how to minimise complications. And I am joined by not one, but two fantastic guests today, and I'm thrilled to welcome both Georgie Hollis and Shelley Jeffries. Georgie is an independent specialist in wound management and dressing technologies. She's lectured widely, both nationally and internationally, across equine and small animal disciplines, and has authored many peer-reviewed articles across the UK and beyond. Georgie also heads up her team of bandaging angels who deliver tailored in-house CPD to help practices refine their dressing selection and overcome their bandaging demons. Shelley Jeffries is a Royal Vet nurse with over 25 years experience and is currently head nurse at a busy mixed animal practice where she has been for 15 years. Shelley's nursing passions are all things wound management, client education and student nurse training. Outside of her head nurse role, she's worked for Bandaging Angels with Georgie for over 10 years, providing training and support for fellow veterinary colleagues. So welcome along, both of you.
Hi, thanks for having us.
Hello.
Thanks for being here. So let's get straight into it. Why is the post-operative recovery period so critical to achieving a successful surgical outcome, and what role does the wider veterinary team play in that process?
So I think recovery is really important, and it doesn't matter how good a job our clinicians can do and how we care for the wound in practice, but actually we need to follow that through to post-op care at home with owner and owner education as well. And I think it's a really broad subject and a really broad area because there are lots of different ways to manage wound care at home, and we have to think about what factors can cause like a wound breakdown at home. And it may be something to do with surgical technique, but also there are lots of other external factors such as patient interference, environmental considerations, poor owner compliance, which may be due to a couple of reasons. It may be that they haven't been told correctly what to do, or they were maybe told in a fleeting conversation in reception and weren't given something written to take home to read and actually process. Or it could be that what they're being asked to do they find upsetting or stressful to do for their pet and how they envisage it. I do think as well, personally, in practice, I think it's really important that owners and all the team members know the options available to them, because quite often, like, it's not just a point of having the reception team there to welcome somebody. Actually, they may hear them saying to somebody else in reception, oh, it hates the cone or it hates having this done, and they can know different alternatives. So I think it's important that everybody in the team, not just the clinical members, know about like options that are available for post-op care.
I think that's a really useful thing to think about. I've never really, thought about sort of front of house being part of that conversation as well. I know when you bandaging angels, when you go in and talk to teams, it is a full team approach, isn't it, to bring everyone up to speed on what's going on.
Yeah, absolutely. And I think one of the things that we do that does make the big difference is we usually nominate a wound nurse at the end of the session. So we tailor what we do to the whole team. So Shelley's got a presentation, but we adapt that to what the needs are of the practice. So in confidence beforehand, we can talk about particular areas that might be challenging. But I think from the nominating a wound nurse, you don't have to be an expert in it, but we can support that wound nurse to be part of that process of getting the team together and helping with the continuity and being a part of that process of making sure everyone knows what's going on with post-op care.
Absolutely. And Shelley, you touched there that some of the problems with post-op recovery or wound breakdown can happen at home. What are some of the most common challenges that you see during that recovery period, whether it be in practice, sort of in the afternoon or day perhaps, that they might still be in clinic, or once they have returned home?
So I think from the point of view of what happens in practice is I think we need to think in practice before we send a patient home. Actually, just because they maybe haven't interfered with their wound whilst they've been in their kennel with us, it doesn't mean that they're not going to interfere with that wound at home. What we need to remember is while they're with us, they're still quite often groggy from their sedation or their anaesthesia. They've maybe still got local anaesthetic techniques in place that are going to wear off gradually. And that may mean that actually in practice, they haven't bothered their wound. But once they get home and those things wear off fully over the next couple of days, they then do start to pay attention to their wound, or no different than you and I. When something starts to scab over and heal, it gets a bit itchy, so then you want to scratch it, and that's no different to an animal wanting to do that. So I think from a practice point of view, we need to be prepared and send them away with equipment, whatever that's going to be, whether it is a cone, a bodysuit, a sleeve, a bandage, or whatever, that they can use if needed, rather than relying on the owner to come back to the practice and say, hey, I'm having a problem. Some people live, a way away from the practice. They may have transport issues, and actually getting back to pick up something if their dog starts licking isn't always that practical. And I think from an owner point of view, we have to think about how these owners are going to cope with what we're asking them to do. And I've certainly seen practices and have worked in practices before where it's been commonplace that everything that leaves the building leaves with a buster collar to go home with. Now, okay, potentially that's good to stop a wound interference, but actually we have to think about those animals and the owner as well. If it's a little old lady, is it practical for that dog to be bashing her in the back of the legs with a buster collar all the time? If it's a big dog that's being kept in a cage, how often do we see dogs that have cones on in their kennels and they knock their water bowls flying because they can't get to the bowl appropriately? If it's weather like it is at the moment and it's really hot, we see quite a lot of dogs we've got quite a lot of working dogs in our group, and we saw quite a few of them that would come back that had cones on that would have like them wet eczema and sore ears and stuff, where everything had just got really hot and sweaty, and actually we just needed to think outside the box, and they didn't need a cone. They did better with a bodysuit. It stopped them from licking, did the job that way, and it was just it was less traumatic for the animal and the owner to witness.
I guess there's a real place, isn't there, for that conversation before the animal goes home, just to take the time to explore what the home life is like and to try and fit the right solution to that patient and that household, rather than, as you say, one size fits all, buster collar, off you go. You mentioned shirts there. So can you talk a little bit about the shirts, or perhaps Georgie, can you weigh in a little bit on shirts, how they might help in recovery?
Yeah, sure. So I guess I came across the development of the medical pet shirts probably about 20 years ago. So the lady who developed particularly the medical pet shirt brand, she put in an awful lot of effort into trying to find a solution for animals that kind of avoided the collar, or at least gave the animals coverage or a protective outfit that would mean that the patient can go home and be cared for longer term without the need for a collar. But I totally understand that there are places where the collar is necessary, sort of for early post-op. But I do think it's been interesting to see the innovation of these pet shirts. I didn't appreciate how much they would be adopted, whether they would be as popular as they are, but certainly I know Shelley has lots of experience using them, and they do seem to be a really valuable part of clinical practice in terms of sending the patient home. I think from a practical point of view, there are an awful lot of copies available now, so I've seen more and more companies sort of copy the outfits, if you like. They're not all the same. So what really impressed me with the medical pet shirts as a brand really is that the material, the measurements, the anatomical fit has always been the priority. So what I have seen is other brands that maybe the material isn't quite as elastic. It doesn't have the stretch quite the same way. So I know that the pet shirt material has a 4-way stretch, which means that it moves with the animal. So it can be a snug fit, but it doesn't rub in one direction or another. So I think what's really good is to see that this technology, or the effort that's gone into developing this pet shirt, is now available more on the Select range. So the brand is now part of an NVS Select range, so it's available for everybody as part of your normal wholesale. So it's the medical pet shirt technology, but now in partnership with the NVS range. So I think that gives a lot more scope for people to be able to order. I think that's when I had a chat with Shelley. It's a case of, while they're available through certain distributors, sometimes you have to only order through one or two wholesalers. So making those available is really important.
Fab. So it's a great product that is now readily available, which is just what we want to hear. Going back to sort of the pet's recovery, I'm quite interested to know how stress can influence recovery in patients. Does it have a particularly negative impact? And if so, what practical steps can teams do to minimise that?
So I think stress has a huge part in recovery. I not only have an interest in wound care, but I have a certificate in rehabilitation as well. And it's definitely something that we look at, and we want to minimise stress as much as we can. Too much stress causes an increase in the stress hormones within the body, and they act a little bit like a steroid would. So it's no different than we wouldn't want to give steroids to patient with wounds and stuff if we could help it, because it will delay healing. So they will have a similar effect. And I think you just have to look at the patient as a whole. They're a stressed patient, their immune system's going to dip, they're not going to be recovering and healing and coping generally, as well as a non-stress patient. And I think that's where we have to look into alternatives. And a bit as Georgie said just now, there are cases where you can't get away from having to use a cone collar because, it may be the location, it may be the sensitivity, it may be the individual patient requires that cone collar. But I think now there are so many different options available to us that we have to look at the practicalities of those and whether it's going to be much less stressful for a patient to wear a medical pet shirt type device than it is to have a cone on their head, and the effect that will then have on them mentally and causing less stress will hopefully then improve their healing time and their rehabilitation time.
I think the important thing with the owners as well is, I think, getting the pet shirts when the client is sent home with those, understanding that they need to check underneath the pet shirt and they need to look at that daily. I certainly have seen cases where a client has come back and it's kind of like 4 or 5 days and they haven't actually removed the pet shirt at all, or they don't appreciate that they can undo the poppers, roll it up so that the patient can go to the toilet. So the practical use of going through with the client how they actually work and what they're meant to do. Roll the shirt up for toileting, that's kind of a unique feature of the medical pet shirt brand. And then is to check the wound daily and contact the vet practice if there is any complication of that. So that's part of the nursing team role, or a nurse who's really into wounds, is to make sure the communication with the client is spot on, give them an idea of what to look for. If there's a wound breakdown, you can have a flashcard image to say, if it looks like this, if it gets red, if it's painful, if the animal does start licking at it, that's probably a sign that there's something that needs attention, as opposed to the shirt's just going to cover it up and it's all going to go away.
I think that comes back to what we mentioned previously, how taking that little bit of extra time when discharging to find out what's going on at home to provide the best solutions. Also taking that time to really talk through everything you do expect and need from the owner, because from a stress point of view, you want to get the animal home sooner rather than later, because it's going to be a better environment for them to recover in, but not at the detriment of things then being missed or unseen, or the situation getting worse because they don't have the correct knowledge to know what to be looking for. So I think that communication means so much of vet medicine, and cases going well relies on communication, doesn't it, within the team and from the veterinary professionals and the owners. So I think it's really important to emphasise how important that is in all aspects of wound care.
There's such a huge focus as well now on AMR and antimicrobial resistance. So observing wound breakdown early is a massive contributor to avoiding the need for unnecessary antibiotics. So bearing in mind that wound breakdown isn't always an infection or a surgical site infection. The surgical site infection might be the tissue tension, tissue not being handled quite as sympathetically as it might have been. So if a client can observe these complications early, it massively avoids the need for subsequent antibiotics, if you get my drift. So just the role of covering, using pet shirts, just giving the clients a little bit of information and knowing how to use those correctly, choosing the right pet shirt that's going to be anatomically correct, because I have seen some that have been made that have a really short back, or there's not a large range of sizes, so you end up with a cat in a one that's too short, and then the axilla gets damaged, and then that's another whole can of worms. So protecting the wound is one thing, observing it, making sure that you get an early call to the vet practice if there is any complications is kind of the second thing. But the nice thing is at least the animal can wear those for some months ahead. If you've got a large wound that's closed by second intention and you've got some scar tissue there, bearing in mind that it may take 3 months for that scar tissue to have the tensile strength it had before. So the pet shirt can be worn long term and quite nice to look at. They're comfortable to wear. So the client's got something that can protect that wound for much longer than just the initial post-op.
Yeah, I think it's interesting to touch on AMR, and I think that's a whole topic within itself, to be honest with you, isn't it? We won't focus too much on that today, but I think it's the awareness of that is increasing. And I think some of our owners are starting to really realise that actually we don't want to just be handing out antibiotics all the time, and they don't necessarily want that for their pets as well. So yeah, that can be part of the discussion as to why looking after these wounds is so important, to avoid having to go down that line. And I think that's added bonus, isn't it? And thinking about how they're recovering from a nursing perspective, what indicators tell you that a patient is recovering comfortably and progressing well and that all is going as it should be?
So, we'd look at lots of things and look at the patient as a whole, but things such as pain scoring, actually looking at the wound and assessing the wound, whether they're eating and drinking, if they've come in just for the day and it's just like a day case surgery, You're not necessarily going to see massive changes in trends potentially, but you can certainly do pain scoring and stuff like that for them. But if it's something that's, a hospitalised patient that's having wound care for a few days before it's going home, we want to be looking at the wound and assessing. We want to be assessing the demeanour of the patient. When they came in, if they were all bouncy and happy and interactive, and now they're just sitting miserable in the back of their kennel, we need to be looking into those things and why are they happening? What's their intakes? What's their outputs? Are they trying to bother the wound with whatever we've got on there? We need to look at that as a whole, I think, when they're in with us.
Yes, it's that full patient picture. And then when you're thinking about protecting that wound moving forward, what other factors influence your choice of approach for each individual patient?
So for me, there are lots of different things that will influence it. One, the primary one will be, how do I think that patient is going to cope with what I'm planning on doing? So it may be that if it's a very young, very active animal, we want to think about ways of protecting that area and maybe thinking about ways of helping to actually keep that patient calm. It's not just about protecting the wound, it's the whole patient. And we need to be maybe having conversations about that. It may not be appropriate to have a cone on. It may be that actually a bandage may not be the best situation for that animal. We need to look at the owner compliance as well. Is it a little old lady who's going to struggle putting a cone on and off to allow her 30-kilo Labrador to eat its food every day? Is it somebody who can lift up a bodysuit and check underneath it, or would they be better with a cone so they can see the wound continuously? I think we have to take the whole thing into account. I do think finance also plays a big part as well. And we have to think about that, especially if we're thinking about whether actually are we bandaging an area, or would it be better to have either a pet suit or weave quite a lot of pet sleeves instead of limb bandages and stuff, because also then you've not got to worry so much about the bandage complications if you're worried about maybe the home situation. So I think it is a whole big picture that you have to look at, and it's not just one factor for the animal. And I think it depends on what the injury is, how severe the injury is, how the healing is approached and what's going on.
When you're discharging a patient from an elective surgery, spay, something like that, how often do you monitor that wound, and what's your sort of recall for the client to come back and check post-op? And when do you know you're in the clear, if you like?
Okay, so personally, we don't have a post-op check. I know some practices will have a 3-day post-op check period. We don't have a post-op check. They just come back for their stitches out at 10 days. However, they go home with quite an in-depth discharge form. I'm a bit of a suckler for, I think that everything that leaves our practice, regardless of whether it's had a surgical intervention or whether it's had something medical done, and you're expecting those owners to follow some instructions and do something at home and care for that pet at home, I don't think it should just be a case of verbalising that in the waiting room or the consulting room with them before they leave, because we've all seen those owners that literally every time a door moves, something, a tap of something, they think their animal's coming down and they're not really listening to what you're saying. I'd be exactly the same. I'd be waiting for my dog to come back through the door. So I think it's really important to give those written instructions that they can then take home and read at home. If they then chuck them in the Rayburn, that's down to them, but we've done our best to try to actually educate them and tell them. So we have an area on our discharge forms that speak about signs of pain and discomfort. We have an area that will say what to look for on a wound if something's abnormal or something's going wrong. We have an area that tells them about their medications. We have an area that tells them how to take the pet shirts off, how to wash the pet shirts. I think we just have to provide that level of education to the owner, regardless of what form of care it's going home with, whether it's a buster collar, a pet shirt, a bandage, an open wound. We need to make sure that they have that written down to refer back to. And also on ours, we have details about what we do out of hours. So we do our own out of hours, but we tell them that they get put through to an answering service, and then the vet will call them back. Please call us. We'd rather you called kind of situation than leave it, because an overnight stint can make things worse. So I think it's just real client education is really, really important.
So we've talked a lot about choosing and how we choose the right item for wound protection and for ideal recovery. But how important is it to also balance wound protection with patient comfort and mobility and the ability to maintain normal behaviours during that recovery? I know we touched upon stress, wanting to keep stress as low as possible. How do these other factors involve how we care for animals post-op?
I think that's still a huge decision maker for me. And I've mentioned it previously, but it's things like, I hate seeing an animal trying to get to their food and water bowl with a buster collar on, that they can't actually get to it properly because they can't coordinate the bowl and their collar. And I just think actually we've got to be real in these situations, that if we're sending something home with that kind of recovery situation, most people work. Most people might take a day or two off for, their pet having surgery, but then they're back to work. So actually, if that person's out to work for 4 or 5 hours, what happens when that animal wants to go for a drink from the water bowl and they knock their water bowl over then without fluid? I think we have to think about the bigger picture. For me, I'd think about something like, one of my pet hates, and Georgie may disagree with me completely here, is I hate a post-op or a hematoma bandage, because I hate walking past a kennel and seeing a dog who now can't open its eyes because once it's woken up and it's moved around a bit, the bandage has slid forward, it's come over its eyes, so it can't open its eyes properly. Or you walk out to reception and it gets excited to see the owner and the bandage goes flying off across the room, or it falls back, or it's really hot and I'm worried that it's going to, asphyxiate at some point because it's so lively. And I just hate them. And I think, this is where we need to look at alternatives. Do we make something homemade out of a piece of tight material, a leg of a tight? Or do we use something like a head sleeve? Medical pet shirts make a head sleeve now, which I love. I personally love, I think they're so much better than a bandage for so many reasons. And I think we just have to look into all these different technologies, but we have to be practical about it. And as Georgie was saying earlier about like different sorts of bodysuits, I've tried lots of different bodysuits from lots of different manufacturers. And I think we have to just make sure. I also think a big thing for me is not just to pick a size that you think is okay and send that patient home with it. We need to fit them in practice and make sure it's appropriate. Because I've certainly seen bodysuits that maybe owners have bought online prior to the surgery and they bring them in, and actually the leg hole at the back is so huge that the animal can turn around and stick its tongue through and lick its spay wound. So it's totally counterproductive of having it on. So I think, it is a big picture, unfortunately, and there are lots of different options and lots of different things available now. We just have to look at what is appropriate for that animal.
Yeah, and Georgie, you mentioned earlier how the shirts can sort of have that 4-way give. So I'm guessing that's going to be much more comfortable for these animals when they're getting up and moving around. I know depending on the type of surgery they've had or the type of wound they've got, we sometimes want to be restricting the amount that they're moving, but obviously we can't stop that completely. So we obviously need to be thinking about how our bandaging can support the animals best possible in that recovery process.
And I think it is really important to have that give, because what the shirts need to be is snug enough to hold a dressing in place, or if you've got a tie over dressing underneath, or you've got a pad underneath to absorb exudate, whatever, they need to hold that securely enough. But if they don't have the 4-way stretch, you'll end up transferring pressure somewhere else. So to end up getting pressure under the axilla when you've had a elective surgery, and then you've got an axilla wound in a cat, that's going to end up being even more complicated and expensive to fix. For a short-term saving on a slightly cheaper at the suit and the complications that can come of it, does sound like I'm biased, but I totally appreciate the amount of research that went into developing the medical pet shirt brand, and how that's been really hard to defend internationally for them, and that they've had to stick with that. The technology that's gone into it and the thought that's gone into it is not only that, the material type. So cotton will allow transfer of moisture. So if you do get exudate through it, it evaporates through. One of the things that is actually one of the unique things with the material is it can be washed at 60 degrees without it changing the texture or the stretch. If you imagine putting your favourite woolly jumper in the wash and putting it at 60 degrees, it will come out a completely different shape to how it went in. So part of the care and the duty of care that has gone into developing these is to make sure that they are as safe as possible, but also you can wash it at 60 degrees. So any bacteria that potentially could re-inoculate the wound once it gets mucky is going to be neutralised in the washing machine. So looking for the washing instructions is usually a good giveaway. If it says 40 degrees only, it's not really enough.
That's a good tip for people to look out for. I like that. And we're talking a lot, aren't we, about owners? And I think it's the veterinary team can do as much as possible at their end and can communicate as much as possible to the owners. But then there's a lot for the owners to have to deal with to hopefully have a good resolution on wound recovery. How can we help that further? Obviously, that, Shelley, what you described about how you really take the time and have it told the owner verbally, but also have it written down and really go through so much more than just the wound care itself, thinking about other aspects around the pet and how they manage their pet. What makes that plan realistic and achievable? And again, I'm assuming it will have to be tweaked from person to person, but have you found any particular things over your 25 years that have really honed in on what hits home with owners to make it achievable for them?
I think things have got to be practical and easy to do. So one thing for me with thinking specifically about like pet suits and body suits is we tried a couple of different brands, and honestly, I got in such a frustration with trying to get them onto these animals because they were like ones that you stood the animal into and then you had to zip them up along the top. Well, if you were trying to hold a dressing in place, or, you know, you've got a dressing there and you're trying to put this on, actually, I struggled to get these on, zip it up without getting the pet's hair stuck in them whilst the pet was jumping around on the table with another nurse helping me. I think actually if I was an owner at home, how would I cope with that on my own at home? So I think you have to think about things like that as well. So like the medical pet shirts are really easy for an owner to put on, same as their leg sleeves and stuff. They just step into them and then there's a popper and a Velcro system and it's in an easy place to locate. So I think you have to think about things like that for me, certainly make decisions. I do think it's quite important as well. Sometimes we have to not assume that the owner's going to know just because they've had dogs for 30 years or, you know, they might be a breeder or something. And I think sometimes that's like, oh, you know, they're a sensible owner. They, you know, they'll know what to do. We can't take that approach with people where everybody has to be educated in the same way, because just because you've had dogs for 30 years doesn't mean that you're going to know what to do with a wound that starts to smell. So I do think, you know, we just have to look at it as a whole and think about it practically for the owner and the patient, really.
Yeah. And have you seen any changes in client expectations around post-op care and patient welfare in recent years? And if you have, can you explain how you think the practice has adapted to that?
Yeah, so I think people are a lot more aware of alternatives now. I think we do certainly get, you know, I'd say a proportion of especially our routine surgeries, so our elective neuterings and stuff, where people actually either ask when they're booking the appointment or when they come in on the morning of the surgery and we start going through, you know, about post-operative. We talk a little bit about it at admission and say, you know, do you think you're going to need a bodysuit? We'd recommend this, that and the other, what have you for post-op. We see a higher proportion now that come in with bodysuits that they've already bought off of the internet, or inflatable collars, or these, you know, fluffy neck collars that look like ring donuts with sprinkles on and stuff. So I think people are more aware of the options available to them now. But I think we then just have to go careful when we're talking to them to make sure that actually, if they've purchased something, is it appropriate but without being patronising to them, because they bought it with the best interests in the world, but actually it may not be appropriate to what's going on. But I do think people are more aware of what is available to them now. Not everybody just wants a cone automatically. I think from the point of view of how does that affect us in practice, we certainly have lots more options now. You know, as a practice, we aren't a big buster collar, as you can probably tell from what I'm saying. We aren't a big buster collar practice. We don't use lots of buster collars because we don't particularly like them. They obviously do have a time and a place and we do have them in practice, but we have lots of alternatives such as bodysuits, leg sleeves, inflatable neck collars, fabric collars, all of which can work just as well in the correct application and with the correct owner education and information given to them. And I think we have to work with that now because people are a lot more aware of patient welfare. And I do think also people are a lot more aware now of asking for help with maybe keeping their pets rested and calm after a surgery, and actually do realise that there are anxiolytic type medications and stuff that can be prescribed now to help in those situations as well. And I think that does form a whole big part of it as well.
Do you find you get any pushback on using the post-op pet shirt or the inflatable collars? Do people want to save money, or do they decline for any particular reason?
Not really. The only time I'd say we have a problem, we're quite lucky in that our reception team are quite good and our nursing team are quite good. We tend to be the two main bulk of people that book surgeries in, and we're quite good when we book in surgeries for giving estimates for the surgery to mention then, you know, the vet may recommend a bodysuit or an inflatable collar. These are in the region of whatever it is for that size of that animal. So it's not, I think we only get a problem when we're doing an admission on something and they've maybe been given an estimate of a surgery, and then we're like, okay, so we'd recommend a bodysuit and it's X amount of pounds more on top. And we've had a couple of people then push back and be like, oh, we just feel like you're trying to upsell. But I think actually if from that initial point of contact and discussing booking in their bitch for spaying, and we talk about the feeding and when to do it around the season and all those kind of things. We just need to add in a little bit about they'll come home with post-operative pain relief and we'd recommend a bodysuit or an inflatable cone depending on the procedure. This adds an extra X amount to it. Sometimes they will then say, oh, we're going to source one online, at which reception will then quite often just pass a phone call through to a nurse and say, could you call these people back to discuss like what they actually need to make sure they're getting the right thing, because we do see some weird and wonderful ones come through that are totally inappropriate. And we had a Labrador come in to be spayed the other day and they turned up with a bodysuit that they purchased online and it was wonderful. It was like pink and glittery and lovely. I would have struggled to fit a Springer Spaniel in that bodysuit, yet they've been sold it as a large bodysuit online. It was just, we just need to help them where we can.
Yeah, and I guess starting those conversations early do help that. And from what you're describing, there is already a shift in behaviour that owners are wanting this more and more. The fact that they are going out and sourcing them, and as you say, in all sort of fun and exciting colours to make it more of a less clinical thing, I guess. But it's that discussion beforehand of making sure that what they're getting is actually what they really need to help from a clinical point of view. Looking further ahead, what developments or trends do you think will have the greatest impact on post-op recovery and patient welfare in vet practice? Do you see us moving in any other directions?
From my point of view, personally, I'd like to see more data collection on post-op. And I think really the trends are going to be based on the knowledge of why things go wrong and at which point. It's not to criticise anyone, but I just don't think I've certainly got quite a bit of data on cases from the past. And it's definitely motivated me to look into that as what can we do with this data? What works? What surgery is more complicated? What complications happen when? What's the impact of that on the patient? So I think from my point of view, I'm kind of diving down the research route of before we can create new things that are going to improve this, we need to know what the benchmark baseline is now. So some of that data I've been looking at is looking at this for open wounds. Say it's time for that wound to granulate, time for it to get to 50% reduction in size, and then time to total healing. And I don't think any products at the moment have a standard where they are on the same baseline of measuring the outcomes. And if we don't have all of those outcomes in a manner that you can compare products, it's really hard at the moment to say what's going to be next, if that makes sense. So when I see a case study that says that this animal healed in 300 days and it had scar tissue that would have been better if it was a reconstruction that may have healed in 30 days. To me, that product might look great, but actually it doesn't mean that the outcome was the functional cosmetic repair with relief of pain and distress and a rapid return to normal use. So I guess my answer to the question of looking ahead, what developments, I think we need more data to show what's important, and it's obviously going to be AMR driven and products that really just improve welfare, make it easy for clients to do what's asked of them and to help contribute to a positive outcome for everyone.
Yeah, I think I agree with Georgie to a certain degree. And I think from a in-practice based point of view, and having been in practice for quite a long time and see lots of things change and evolve, I think encouraging practices to get involved in things like clinical auditing of like post-operative wound infections and stuff. And everybody kind of winces at the thought of clinical audits, and I did initially, and I love them now in a really weird kind of way. I love doing them because I love to see if there are any of those little trends and stuff. And it's actually so easy to do. And that can be a huge key into looking at your post-operative care. If actually you're suddenly getting a lot of patient interference in your post-operative care audits, you can then look to see, okay, how many percentage of that patient interference had maybe no form of protection sent home with them? How many of them had a cone? How many of them had a bodysuit? To see if there's a trend. And I think possibly slightly off topic of this question, but I think for me, when I'm choosing like what I'm going to use as well, and I'm thinking about what the owner's going to do, I think a little bit like a fat club weight clinic kind of situation. If you're telling that person they can no longer give that chocolate Labrador who looks into their soul with those eyes a treat, a buster collar that when they go to put that buster collar back on that dog's head, it looks into their soul and says, I hate this, I don't want this on, they've got to chase them around the house, they're not going to do it. So we need to think about something else.
Yeah, that's so true. And I think what you say about auditing is so useful as well. And I think perhaps it needs to be reframed that there's not a finger pointing or looking for blame. It's out of curiosity and reflection of saying, how can we serve our clients better? How can we do better as a practice and sort of progress that way rather than where are we going wrong, I guess, which is a useful thing for practice to do, not just in wound management, but in lots of different aspects within the practice.
And it's also a good opportunity to say, hey guys, we've done really, really well this quarter. This has been really positive, or we made this change and this has happened. It's not a clinical audit, shouldn't be thought of as being a blame situation. It's looking to improve our patient care and our patient welfare and our outcomes. And at the end of the day, we should all want that for our patients.
Yeah, absolutely.
There were certainly a few cases where people have said they started to get complications that they hadn't had before. I think it was during COVID, asking in private. And you can tell that people are really embarrassed that rate of surgical site infections has gone up. It's kind of drilling down as to what's changed, what are you doing differently? And it just came down to very simple thing of their usual scrub wasn't available. They were using a different one and it wasn't lathering in the same way. And it was just different. And it was just down to one tiny bit. But what a relief for them to find out what the solution was and fix it. So an audit is not a bad thing. It's just problem solving, making things a little bit better, and then celebrating when it's a bit like being a detective. Everyone likes a good dig into that, problem solving. So
yeah, and that's what veterinary teams are, I guess, aren't they? They're problem solvers, they're detectives, so that fits perfectly. Thank you both so much for joining me today. It's been really interesting to hear your lived experiences and your sort of research that you've done in this area. So it's been really, really useful. And I do hope our listeners have found it enjoyable and useful. And I do urge you all to go and check out the medical pet shirts on the MVS website, or check the MVS website for any more information regarding shirts, regarding wound healing, or indeed any other services that MVS might be able to help you with. So thank you very much, Shelley and Georgie. It's been an absolute pleasure having you here today.
Thank you very much.